Today we have Dr. Erik Osansky with us, who is a chiropractic physician, a nutritionist, and a certified medicine practitioner, and he focuses mostly on Graves' disease as well as Hashimoto's. He himself had Graves' disease, just like I did. He was super fortunate that he was able to put his in remission by natural means and not have to take the terrible medications that I had to have, or to have his thyroid ablated through Iodine 131 or taken out by surgery. So I'm very excited to talk with him about everything he did to reverse his Graves' disease. I've read his book, which is Natural Treatment Solutions for Hyperthyroidism and Graves. And he's also has created a website, naturalendocrinesolutions.com. So welcome, Erik. How are you?
I'm doing great, Dr. Myers. Thank you for having me. I'm excited to be here.
Yeah, well, we're really happy to have you. As you know, being one of the few people, not few, there are plenty of people with Graves out there, but what really gets its glory and its time in the press typically is Hashimoto's. So when I was writing my book, The Thyroid Connection, I didn't want to limit it to just Hashimoto's, being that I myself had Graves. And so definitely a whole host of the book is about how to treat different thyroid conditions. And so wanted to talk with you today about Graves, your story, and what you did to reverse that, and how you're working with patients to help reverse that. So I guess just sort of starting off, do you mind sharing your personal story with us?
No, not at all. It actually started, or at least I started finding out about it at a Sam's Club. I was walking around a Sam's Club and they had one of those automated blood pressure machines, and I decided to sit down and take my blood pressure. And my blood pressure was fine, but my pulse rate was elevated, which wasn't common. So I thought maybe it was just because I was walking around, and so I checked my pulse manually later that night and the next few days, and it remained elevated. And at that time, I wasn't really familiar with hyperthyroidism and Graves' disease. But as I did a little bit more digging, and I was experiencing a good amount of weight loss and increased appetite. But at the same time, I was also dieting and detoxifying for a few months. So I just attributed to the diet and didn't think twice about it. But then once I had the increased pulse rate and then started putting the pieces of the puzzle together, but eventually I went to a primary care physician who ran some blood work, did the TSH, the thyroid hormones. And so he diagnosed me with hyperthyroidism at the time. And he recommended a beta blocker, which I didn't take. And, looking back, I probably should have done something, because it was a couple of months until I saw the endocrinologist after that, and I didn't do anything to manage the symptoms. And we could talk more about that. But long story short, I saw an endocrinologist about 2 months later, and she diagnosed me with Graves' disease. And she was actually pretty conservative. She didn't recommend radioactive iodine, surprisingly. I actually had to talk her into giving me an ultrasound just because I wanted to make sure I didn't have any thyroid nodules, which I didn't. She recommended methimazole, which is, you're familiar with, an anti-thyroid medication. And I didn't take that either. And the reason is I knew I was going to do something naturally. And I was also skeptical about natural methods. I didn't know if they would help. But when I was getting my continuing education credits, I would always go and attend nutrition courses. So I attended in the past some functional endocrinology courses. So I knew there was some hope, even though I didn't know much about it. So I didn't take the methimazole. I started working with someone else on helping me get my Graves' disease into remission. And I saw the benefits relatively quickly. I took some herbs, of course, cleaned up my diet, managed my stress levels. We did a good amount of testing. And just over time, my symptoms improved, my blood tests, improved. So I did saliva testing, and my adrenals were shot in the beginning, and those the adrenals improved. And then, so slowly got into remission. And then, over time, I just decided that I was going to help others with thyroid and autoimmune thyroid conditions. And so I started helping people with Graves' disease as well as Hashimoto's. And as you said, and as you know, there are a lot more people with Hashimoto's. But I probably see an equal amount just because there's more Hashimoto's, but there's the affinity with Graves. Since I have Graves, I see a good amount of people with Graves' disease, and that's why I wrote the book as well, The Natural Treatment Solutions for Hyperthyroidism and Graves' disease. And that pretty much is my story.
So that's great and just so encouraging. And we'll dig a little bit deeper into the specifics of that. I wanted to know, so you were a practicing chiropractor at the time. Were you doing, any type of functional chiropractic, or was this kind of your first foray into something and then you changed your practice from there?
Yeah, I wasn't doing much from a functional medicine perspective. It was pretty much just a typical chiropractic practice. I did at one time have a naturopath working with me, and so I delegated the functional medicine duties to her. And, I did speak about nutrition. As I mentioned, I did attend nutritional conferences, but I didn't incorporate too much nutrition into the practice. So it wasn't until I was diagnosed with Graves and then, just restored my health and got into remission that I started focusing on other people with these conditions.
Great. Yeah, it's like the proof is in the pudding, right? I had the opposite story in a sense of, having gone through and had a very terrible experience with conventional medicine. I searched and searched and searched. Of course, this was more than 10 years ago now, about 12 years ago, 13 years ago when I had mine. And, there really nobody was talking about anything like this. So I searched and searched and found nothing. So as most people know, I went through PTU, which I then got toxic hepatitis, and then the iodine 131. So, I now practice how I practice, and nobody has to go through what I went through. So kind of, same disease, different outcomes or different pathways, but same outcome, that we're both here with the desire to help people with autoimmunity and Graves. Well, let's kind of go over, you talked about some symptoms for you on this high heart rate and weight loss. Why don't we kind of go through some of the symptoms of maybe Graves' disease and how they're different or even similar to those with Hashimoto's? Because, I think you probably see this as well, that there's certainly people who can have some of the symptoms in both categories, or even have opposite symptoms and think, well, how could I have Hashimoto's patients who are losing weight. And so when I want to put them on thyroid replacement hormone, they're leery because they're already losing weight. But then once they go on the hormone, their weight stabilizes. So why don't we just walk through quickly just some of the sort of characteristics or symptoms that somebody might have in case they're listening out there wondering if maybe they do have Graves' disease or hyperthyroidism.
Sure. Well, some of the symptoms, increased pulse rate, heart palpitations, again, the weight loss that I experienced, and tremors also are common. And then sometimes loose stools, because again, this is increasing the metabolic rate. So as far as comparing with Hashimoto's, a lot of times it will be opposite symptoms. So with Hashimoto's, you might get constipation, Graves' disease. Even though some people with Graves are constipated, a lot of times you'll get the loose stools, sometimes even diarrhea, depending on the condition. And, the elevated thyroid hormone levels could sometimes cause insomnia, problem sleeping, which, of course, people with Hashimoto's also experience insomnia as well. But the classic symptoms typically are the weight loss, increased appetite, the tremors, increased heart rate, palpitations, loose stool. Hair loss is pretty common with Graves' disease, and I know with Hashimoto's, a lot of people with Hashimoto's as well experience the hair loss. Energy levels vary. With Hashimoto's, you typically see the lower energy levels, more fatigue related. When I was dealing with Graves, I didn't feel low energy. In fact, even though my adrenals were shot, which if you looked at my adrenals, you would think that I would be fatigued all the time. But the increased metabolism, I think, kind of offset that.
And or all the adrenaline from your...
Exactly.
Yeah.
So my energy was pretty good, but it varies. I'll speak with some people with Graves, and usually if they've had it for a prolonged period of time, for years, then the fatigue is more likely. But it does depend on the person, as you know. There are some people that have had it recently and, got diagnosed recently and, their energy levels are low, and those who have had it for years and their energy levels are okay. But so those are some of the classic symptoms. And again, sometimes you get the non-classic symptoms like someone with Graves' disease who's actually gaining weight, which frequently is due if they're taking the PTU or methimazole, although every now and then they're not taking that and they're gaining weight, what makes it a little bit challenging to determine why. But yeah, so those are some of the more common symptoms associated with Graves.
Yeah, I was kind of the tired and wired. I had really, really bad insomnia. And so, I couldn't sleep, but then I would like wake up and was, exhausted, but then all the adrenaline and the high heart rate and, I was losing weight and I was warm and I definitely had tremors. And then I started, having like muscle weakness and stuff too, because I think I was even just, burning through what fat I had on my body and going to my muscles. So, yeah. And what about, why don't we talk about some of the lab testing, kind of trying to distinguish between Hashimoto's and Graves as well?
Sure. Well, with Graves' disease, typically you will have the depressed TSH levels, thyroid stimulating hormone, whereas Hashimoto's, in most cases, that'll be elevated. And the thyroid hormone, and the reason for that is because in Graves, you have the elevated thyroid hormone levels. So if you do the free T4, free T3 is what I typically recommend and probably what you recommend. And so, with those being elevated, typically the TSH not only depressed, but in most cases undetectable. Mm-hmm. And again, with Hashimoto's, it'll vary. As you know, TSH frequently will be elevated. The degree of elevation will vary, but not everybody has low thyroid hormone levels with Hashimoto's. Sometimes it might look fine, the blood test. It takes, that silent autoimmunity phase, could take a lot longer with Hashimoto's when compared with Graves' disease. And then there's different autoantibodies involved as well. With Hashimoto's, you have the thyroid peroxidase antibodies and thyroglobulin antibodies. Those are more commonly associated with Hashimoto's. With Graves' disease, you have TSH receptor antibodies with thyroid-stimulating immunoglobulins, the most common type. And, what that means is just different areas of the body are being attacked by the immune system. So with Hashimoto's, the thyroglobulin protein of the thyroid gland and the thyroid peroxidase enzyme is, those are being attacked. And then with Graves, you have the TSH receptors being stimulated by the immune system and attacked by the immune system. And that is what results in the increase of thyroid hormone. And so those, I don't know if you just wanted to go over the basics as far as thyroid-related tests involving.
Mm-hmm. Yeah, did you, there's certainly, I'm pretty sure you talk about it in your book as well. There's certainly a whole host of nutritional, tests that can be off as well. So is that what you're wanting to speak to next?
Well, just in general, you and most functional medicine practitioners will run just the complete blood counts and comprehensive metabolic panels and lipid panels and CRP. So yeah, it just doesn't stop at. I see a lot of people, all they get is the free T3. Well, a lot of people don't even get that. Some people just get the TSH, but a good number of people, all they'll get is a lot of people will get the TSH and the thyroid hormones. Some will get the antibodies, some won't. But oftentimes they'll just stop with the metabolic panel. And the reason a lot of endocrinologists will do the metabolic panel is you could share your experience. You had the elevated liver enzymes, so they will frequently monitor those. But as far as doing other tests, vitamin D, very rarely will they test for vitamin D, even though that's important for a healthy immune system. I run an iron panel on many of my patients, B12. So yeah, there's definitely a lot of tests that I think could give some good information.
Yeah, in addition to, and I think you mentioned these as well, selenium and zinc and vitamin A, D, iodine, that's somewhat controversial as to how to test iodine and what, someone's needs for iodine are. But, all of that is definitely important because it helps make the thyroid hormone and then helps make these conversions.
Exactly.
Yeah. So, I guess since we're kind of on the topic of iodine, what is your feeling about iodine for those with Graves' disease and Hashimoto's?
Well, as you said, it's definitely controversial. And probably the best thing to do is to give my story when it comes to iodine, because when I was diagnosed with Graves' disease, I didn't really know much about iodine. I knew, of course, it was a mineral and all minerals are important. But with regards to thyroid health, I really didn't have a good understanding of iodine. So the natural healthcare professional that I work with, she was big into recommending iodine for Graves as well as for Hashimoto's. And so when I was diagnosed with Graves' disease, I went through the urinary testing for iodine and was found to be deficient. And so I was put on an iodine protocol and was told to take larger doses of iodine, not quite as high as some people take. I know some people will take 50 milligrams of iodoral. Some people will take larger than that, but it was around 25 milligrams. So I was taking a good dose of iodine, and honestly, I had a good experience with iodine. So I didn't, I had a positive experience, and you know how it works sometimes. If you have a positive experience with something, it's like, oh yeah, everybody, I gotta, tell everybody about iodine and test everybody for iodine, and that's how I was with my patients. I pretty much initially would test just about everyone for iodine. And again, a lot of people did receive some good benefits, but then, I realized that there are also risks. Of course, research has come out where, it could be a potential trigger for certain, for thyroid autoimmunity as well. So again, it is one of those double-edged swords where I still like iodine, and I still, at times recommend iodine, but I'm cautious about iodine. So I'm not, so I have changed my approach in the past. I don't have everybody test for iodine, everybody take iodine. I think if someone is thinking about taking iodine, I think first of all, it's important to work with someone, because I think part of the problem is, people just self-treat their condition. And then I think besides getting tested, which again, someone who you're working with hopefully will test, but I think it's important to have healthy levels of antioxidants. I think that's part of the problem too. Not to say that people could take 50 milligrams of iodine even if they have healthy levels of antioxidants, but if you're having deficiencies in selenium, which is a cofactor for glutathione, that's going to create more problems, because, with iodine, it's involved in, as you said, the production of thyroid hormone, and there is oxidative stress involved, and so you definitely need antioxidants.
And nowadays with all the bromides, fluorides, the rest of the halides, if you go into taking large dosages of iodine, for some people, it's you're detoxing, or it's displacing all of those toxins, the fluorides, bromides, and chlorides. And so if you don't have your antioxidants up or your glutathione levels up, a lot of people can have bad reactions or feel bad, like a detox reaction.
Exactly. Yeah, that's a good point. Some people do feel bad, and it's more of a detox reaction. So yeah, you definitely need to weigh the benefits and the risks. And if you take iodine, I definitely, besides working with someone, and hopefully the person you're working with will start with smaller doses. I like iodine. Iodine has some great benefits, and but I'm more cautious with iodine than I was in the past.
And just for our listeners, because they might not know a lot about it, how exactly were you testing?
So I was testing when I received the test myself. I had what's called the iodine loading test. And I'm sure you're familiar with that. Mm-hmm. So what that is, that's actually taking a 50 milligram tablet of iodoral or potassium iodine, and measuring the excretion of the iodine over 24 hours. So again, if someone with Hashimoto's wants to test for iodine, and again, I usually I prefer improving the health of their immune system first in most cases, in those with Hashimoto's. And with Graves', one could also make the same argument too, but it seems that with Hashimoto's, it's more problematic. But it's if they want to do it though, a lot of times I'll have them do the spot test. And you mentioned bromide. You could actually test for bromide, do an iodine spot test, and because I don't completely trust the iodine spot test, so if it's low, I think someone will eventually need to correct that deficiency. But even if it's looking good, but if bromide is high, then because bromide competes with iodine, that's a pretty good sign that you also have an iodine deficiency. So again, if someone were to test, those are the difference. I don't usually recommend testing in the blood. I don't think that's a good method. So I would recommend urine, but again, the risk of the loading test is that you do have to take the potassium iodine in a fairly large amount before collecting the urine sample. So for a lot of people are more comfortable, and a safer option would be to do the spot test and then testing bromide. Although, again, I did the iodine loading test and was fine. And, in the past, I've had numerous patients do the iodine loading test.
Have you had anybody have any bad reactions?
I haven't had any patients really have any bad at least none that told me that they came back and had a bad reaction, a negative reaction. I did once have a person email me who said they were taking iodine and they had thyroid eye disease and it flared up their thyroid eye disease. So I had that, and there's been other stories through email. People just you get different stories. People who had some bad experiences, but that's probably the worst experience I've heard as far as someone who just said, yeah, I took iodine, my thyroid eye disease got worse. And I forgot to mention thyroid eye disease is one of the symptoms also.
Oh, right,
about the symptoms of Graves' disease. But, so yeah, if someone, that's maybe also something to keep in mind. If someone has very high thyroid stimulating immunoglobulins, that I do see a correlation between that and a higher incidence of thyroid eye disease. And maybe you do want to be more cautious with the iodine in that case.
Right. Yeah, so I mean, just to put it in perspective for people, most people are getting on the microgram level of iodine a day.
Mm-hmm.
So just trying to kind of put all this in perspective, for most people, they're taking microgram dosages of iodine. So just through your diet, or maybe, like I have a multivitamin that, has what I perceive as kind of everything you need in one multivitamin to support your thyroid. And I have microgram dosages of iodine in it. But what you're referring to and what is the controversial aspect is not do we need iodine in our diet, it's how much do we need. And there are certain people out there recommending these milligram dosages, so hundreds if not thousands of times larger than what someone is getting in their diet. And the thought behind that is one, we took iodine out of our salt, we're not eating shellfish and seafood as often, we're not eating seaweed, and then we've bombarded our systems with bromides and halides and chlorides and fluoride, and so is displacing all this iodine. So just for people to put that in perspective. And I personally don't use the super high dosages of the iodine. It's just too controversial for me. But, I've had people like yourself who've come in and just, swear it was really one of the biggest factors that got them well. And then I've also had people coming in swearing that it was the thing that, a practitioner recommended it to them and it's why they have their thyroid dysfunction. So, I think the bottom line is the jury is out. And, if you're using that and you feel comfortable with that and you're having success, that's great. That's how we learn about these things, is that you took high dosages, you had success, you've tried it with your patients. It's just not something that, I've tried it on myself, but I don't have a thyroid. So, I don't really have something quote unquote to mess up if it's, if it's, doing something bad for me. So I've taken the very high dosages briefly and, didn't, I kind of felt like I felt better. Maybe it was getting some of those other halides out of my system, but I didn't notice anything in terms of my thyroid function because I'm on, desiccated thyroid hormone every day. I don't have a thyroid. So I don't think I'm a good example of, does it work or does it not work?
Yeah, and I think part of what iodine, it's not just the effects it has on the thyroid gland. From a positive perspective, it also, it's an antimicrobial, so it might help some people because, again, infections could be a potential trigger with autoimmunity. So that could help in some cases. It also helps with estrogen metabolism. So it does have other benefits, but again, yeah, there definitely are risks as well. It's not like avoiding gluten. If you avoid gluten, there's no risk really in getting rid of the gluten. But when you're taking vitamin D, if you're taking vitamin D, minimal risks unless you're taking really high doses. Maybe if you're taking 10, 20,000 IUs for many, many, many months. But otherwise, but with iodine, yeah, I agree that you do need to be cautious.
Yeah, well, so you brought up some great points, which is really getting to the root cause of, how this happened in the first place. And certainly some of that can be, nutrition or nutrient deficiencies, but you've also hinted at infections and diet. I know in my book, and I think you talk about each one of these. If not, it's okay, but maybe we can walk through these. I talk about, the diet, leaky gut, infections, stress, and toxins. So maybe we can kind of walk through, each one of those and hit to, things that you've seen that seem to correlate with Graves' disease. And then we can kind of walk through the herbs that people can be doing to calm their thyroid while they're working to find their root cause. So I don't know where you had mentioned, I think first that you changed your diet. So maybe you want to talk about, what you changed your diet to and what you have your patients do.
Okay, well, when I was dealing with Graves, there really wasn't much out there as far as autoimmune paleo diet. So I probably followed more of a standard paleo diet. So as far as like nightshades, for example, even though I've never been big into eating tomatoes, and I don't think I did eat the white potatoes anyway at the time. So I essentially was eliminating the nightshades, but not because I was trying to follow an autoimmune paleo diet. But of course, whole foods. I mean, that's all I ate. I stuck with the whole foods, increased my vegetable intake. And, again, I did eat, in my case, a good amount of meat at the time, but made sure that I ate plenty of vegetables, which was hard because I grew up not eating vegetables. I didn't live a healthy lifestyle and I didn't like vegetables. So it was a challenge making those changes, but I knew what I had to do. So, but pretty much was whole food based. And with my current patients, what I usually do is I will start them on an autoimmune paleo type diet, which is similar to a standard paleo diet, except again, the nightshades are avoided, the eggs are avoided, the nuts and seeds are avoided. And I usually will have someone with Graves try that out for at least 30 days. Same thing with Hashimoto's, at least give it 30 days. If after 30 days they're doing great with the autoimmune paleo diet, then of course I'm fine with them continuing with it, and I'll encourage them to continue with the autoimmune paleo diet. If they're struggling, I am open to them reintroducing some foods. Of course, it depends what the food is. I prefer for them to continue to avoid, the common allergens like gluten and dairy. But with, for eggs is a good example. So, if after 30 days, someone, especially with Graves' disease, because again, Graves, you have the increased appetite, you have the weight loss, and a lot of times it's a mental game too. Even though the goal of with an autoimmune paleo diet, you're not trying to restrict calories, but still, a lot of people with Graves' disease feel like they're not eating enough, that they need more. So sometimes just introducing eggs alone can help a great deal. But of course, you got to remember why eggs are excluded from an autoimmune paleo diet, and that's because eggs are a common allergen, and also the egg whites have compounds which could potentially affect the permeability of the gut. So it does sometimes become challenging. If someone reintroduces eggs, and if they're feeling fine, if they're progressing well, then that's great. Keep on eating the eggs. Of course, if they're not doing well, if they're symptomatic at all, or even if they're not symptomatic, but they just hit a roadblock and they're not improving, then they probably will have to give up the eggs. And
they could also try, I personally eat egg yolks, but not the whites. So that's another option.
Yep, and that is true. Because you're not getting, if you're allergic to eggs, that might not help. But as far as affecting exactly. So so that is an option too. Just eating that's what I do too. I add the egg yolks to my smoothie, the raw egg yolks, and I have eggs that way. So everybody is different. I don't think everybody needs to follow a strict autoimmune paleo diet for a prolonged period of time, and it's definitely, in my opinion, it's not a forever diet. I know some people, if someone is sensitive to, if someone has problems with eggs or nightshades, then they might need to avoid these foods on a permanent basis. And usually I try to get people, when they're in remission, to try to follow more of a standard paleo diet. So that's my ultimate goal is, and maybe even like kind of a Mediterranean. So I'm fine if they're eating some rice or something. Again, this is once they're healthy. Now, everybody's different. Not everybody obeys the rules, as you know. So some people will add some of these foods sooner than later. So there will be some people who will, add rice sooner than later. Some people even will try to add dairy. And I mean, everybody's different. There are some people who I've had who've added raw dairy, for example, and they do fine. It's not something that I encourage. I don't tell them, okay, let's go ahead. But if they, some people are asking me, well, can I add it and over again? And the only thing I could say is, well, if you really want it, you could try. I just don't know how you'll respond. You might do fine, you might not. Of course, the problem also is sometimes if someone is sensitive and it causes gut inflammation, that inflammation might last a while. It might not just be a day or two thing where it goes away. So that's the challenge with that. But I do offer some flexibility depending on the person.
Yeah, I agree. I mean, when in the autoimmune solution that I wrote, I talk about a spectrum. And, I think once we're on this spectrum of having been diagnosed with autoimmunity, I mean, I do feel like it's a little bit like cancer, like you can go in remission, but it's always there, kind of, potential to come back out. And so, you're kind of sliding up the spectrum. And if you do, you got to hone more in on the diet, or if it's the stress, or you went traveling and picked up a gut infection, and then you can slide back down that spectrum, and you might then be able to eat a gluten-free, dairy-free cookie or a piece of cake for your birthday. But but for me, I do feel like there are some absolute no's, which is typically gluten and dairy. Now, when I say dairy, it's like you're saying, I mean, some people might be able to do raw or might be able to do raw, goat or sheep. And those are all things that people have to figure out, on an individual basis. Okay, so we have diet. And then how about gut? Do you want to mention anything about gut and its relation to Graves and autoimmunity?
Sure. Well, as you know, the theory is that there's the three-legged stool of autoimmunity where you have the genetic predisposition, the environmental trigger, and then a leaky gut. And yeah, I do find that most of my patients have a leaky gut. And the reason I know is because I used to do a lot of testing using the Eriks labs, Array 2, the intestinal antigenic permeability screen. So and I've also used the lactulose mannitol test. And I have found that when I did use it, I pretty much assume that most people have a leaky gut. But I will say, in the past, I have found people who did the testing, who did the leaky gut testing, and they had elevated autoantibodies, and they came back negative for a leaky gut. So that did bring up a little bit of controversy in my mind. Are the tests maybe not as accurate, and maybe they're giving false negatives? Or, is maybe not everybody really does have a leaky gut? So again, I'm not sure, but I do usually assume that someone has gut issues, and I will do things to support the gut. Obviously, if someone is presenting with gastrointestinal symptoms, then, I might get even more aggressive. But as you know, you can't always go by symptoms. So it's not uncommon for someone to say, I'm not experiencing any bloating or gas or any other digestive symptoms. So they think that their gut health is fine. But, again, you can't just go by the symptoms, or sometimes it might not be digestive symptoms. Leaky gut can cause other symptoms, might cause headaches, neurological symptoms. So, yeah, I think in most cases, and possibly all, I'm still not 100% convinced, but as far as that intestinal permeability component, if I had to guess, I would say yes, just because it does make sense. I mean, if you look at the physiology behind it, it does make a lot of sense. But just from the testing I've done, there's been a small percentage who tested negative with both lactulose mannitol and Eriks lab testing, yet had the elevated antibodies. And again, that might have been a flaw of the testing itself.
Yeah, no, I completely agree with you. I mean, people come in and they hear me talking about leaky guts. Everybody wants to test, and it's like, well, I'm just going to assume you have it. And if you don't, I mean, there's some dysfunction because we have immune dysfunction. So, I'd rather you spend your money on a stool test where I can see what's going on in the gut rather than this test of whether you have leaky gut. I mean, I've done it on myself, and I think it's helpful if you, want a baseline. And if you do have leaky gut, then you can see that it's, healed. But, most people just don't have money that they want to throw around like that. So I make the assumption, and I agree with you. Is it a problem with the test? I've very few, but I have had people who have autoimmunity and they don't have a positive, leaky gut test. So is it a problem with the test, or is it, that we know that they're celiacs that don't have the genes for celiac? I was speaking with Richie Shoemaker about a patient that I had who I know is has SIRS and is in a mold, water damaged building, but she doesn't have the genes for it. So should she get out, and can that be the reason for her SIRS, or could it be something else? It's like, no, that could still be her reason. So, I think it's probably twofold. Maybe the tests aren't 100% perfect because no test is, right? Mm-hmm. And then two, that not 100% of people have to have a leaky gut or leaky enough that it's showing up on a test in order to have autoimmunity. That makes sense too, right? That it could be, a genetic component, could be stress that's causing it, So we're on the same page there. Okay, so we've talked about diet, we've talked about gut. How about we talk about toxins? Any toxins? We've briefly mentioned some with the halides, but toxins related specifically to thyroid or Graves' disease?
Well, in the literature, specific to Graves', there's not a lot of literature linking specific toxins with Graves'. Now, there is some, as far as bisphenol A, which is BPA. So there is a lot of research on that. And there are some links with autoimmunity and being an endocrine disruptor. So I think it's safe to say that you want to avoid the best that you can, the BPA and
probably plastics in general.
Yeah, well, I was about to say,
because even though it says BPA free, it's like there's going to be BPS,
the bisphenol S, and the BPF. So you're right. So there are, so you want to try to avoid the plastics and even the receipts. The receipts are a big deal these days as well. And then, of course, the toxic metals. Mm-hmm. So mercury. Again, in the literature, it's more closely correlated with Hashimoto's. Mm-hmm. And even that, there's not a ton of studies, but there are some studies that link it with Hashimoto's more so than with Graves'. But it can't be a coincidence. When you look at, there's tens of thousands of chemicals in our environment that weren't present, decades ago. And you get that increase in autoimmunity. So that, so again, I think and plus, as you know, when they do these testing, they test these chemicals in isolation. So when especially when you're using a skincare product or, cosmetics or eating processed foods and you have multiple chemicals, we don't know the combined effects of these different chemicals. So again, I think there's definitely a correlation. And as a result, I definitely have people do things for detoxification. Yeah,
so not only do they test them in isolation, they also leave it up to the manufacturer to test the chemicals. So, most people don't really realize that most chemicals get approved by the EPA within 3 weeks or less, and they rely on the company to test the chemical. And then, as you said, they test a chemical in isolation. So whether it be, something to fix your car, to clean your home, to clean your body, if something has 5 or 6 ingredients in it, they're only checking one ingredient at a time, and they're not looking to see how that interacts with the 5 other ingredients in that particular product. And then nobody's using just one product to clean their home or their car or their body. They're using 5 to 10 different ones. And so then what are all those different products and how do those correlate? And then, the levels of all the different, that you're using 10 different products, not just one in a day. So that's why toxins are really a problem, but also somewhat of a mystery, or they're able to get by with it because in isolation, one of those things doesn't cause a problem, but it's really this, effect over time of multiple different ones. Okay, so then why don't we talk about some infections that might be specific to, thyroid or certainly Graves'?
Sure. Well, H. pylori, there's definitely a correlation between H. pylori and Graves' disease in the literature. And I've also seen in my practice too. That's something I do commonly test for. And, I've seen people test positive for H. pylori, and then we, get rid of the H. pylori. And of course, there's different ways of doing that. Some will choose antibiotics. There are natural methods. But either way, I've had some people get into remission by getting rid of the H. pylori. Yersinia enterocolitica, at least in the literature, is associated with Graves' and Hashimoto's. And it's something I haven't seen too commonly. Now, to be fair, I don't run a comprehensive stool panel on every single patient, but I've done enough where I figured I'd see more of it over the years. And I've seen a few cases, but again, not as much as I would think.
Yeah, I'm the same, and I don't know if that's again a testing issue because it's very difficult to test for, or if that it's in the literature. But it just, what's if people don't really know, what's in the literature is not always what meets what is in the clinic.
Exactly. And
so it's always
true.
great to talk to another clinician because what we see every day with our patients often does not match what the scientists are seeing in a lab.
Mm-hmm. Yep. Yeah, you're right. And then viruses, there's certain viruses, Epstein-Barr, cytomegalovirus, probably more commonly associated with Hashimoto's. And I do see those also with some Graves' disease patients. Now, whether those are triggers, we don't know for sure, because again, a lot of people test positive for Epstein-Barr and maybe it's not a trigger. But there's hepatitis C. There's actually in the literature some research correlating hepatitis C with Graves, but again, not something I commonly see in practice. I do see a lot of people with candida, as I'm sure you see.
Yes.
So again, whether or not that's a cause or effect of Graves' disease or Hashimoto's, I'm not sure, but if I see it, I am going to try to address it. And, and then Lyme disease, which, so I don't focus specifically on Lyme disease. If someone comes to see me just for the Lyme disease, I usually, especially if it's chronic Lyme disease or even acute, I'll refer them out to someone else. But, I'll get some people who have Graves' disease or Hashimoto's, and they also have Lyme disease. And again, seems more, probably I more commonly see people with Hashimoto's who have Lyme, but I've also worked with patients who have with Graves' disease who also have Lyme disease as well. So again, that could be a potential trigger as well. Not a whole lot in the literature showing that it's a trigger, but again, and that's the thing with these infections. Sometimes you're not sure if it is if they are the actual trigger, or because someone had problems, a compromised immune system, maybe that led to them having not Lyme, of course, because Lyme is a tick bite, but due to a tick bite, but with candida. Getting back to candida, that's one where I wonder, is that a potential trigger, because there's not a lot in the literature. So I don't know what your thoughts are on with candida and autoimmunity.
Yeah, I think of it personally, my thought about it has been mostly that it's a secondary, that autoimmunity is secondary to candida, and that candida is there creating the leaky gut, and then the leaky gut creates the autoimmunity. Certainly for some, I see it, antibodies towards candida, that their immune system is actually, fighting the candida. There really is nothing that I've seen in the literature about the actual candida infection like the others, creating, the hijacking or the, creating situations where it itself is causing the immune system to attack it, and then through like molecular mimicry or something like that. So I haven't seen anything like that. So my own thought about it just by seeing patients is that it probably was more creating the leaky gut and some inflammation that led to the opening of the floodgates, so to speak.
And that's probably similar with SIBO, small intestinal bacterial overgrowth. I see, and I'm sure you see more and more cases of that these days as well. And that's probably a similar mechanism in that, there's definitely a correlation between SIBO and increased intestinal permeability. So,
and there's SIBO, and there's definitely some literature out there about that with Hashimoto's and hypothyroidism. So, that's kind of my thought about it as well. And then the only other thing I wanted to bring up when we were talking about toxins, one thing that we didn't discuss, and I have a whole talk with Richie Shoemaker on this, but just as the water damage buildings and SIRS and mycotoxins and molds being a toxin. So a lot of people don't think about that as a toxin, and it's one that is commonly missed. Even in functional medicine, I think it's getting more widely suspected, and people are beginning to test for it more or consider it, but it's not even something that I was ever taught in functional medicine. It was just through my own personal experience. So people definitely need to think about that when we're talking about the toxic category. And then stress, save the biggest one for last. I know that was definitely a big factor for me. For my autoimmunity, I had returned from the Peace Corps, and the adjustment back to the United States was far more difficult than it was to adjust to the Peace Corps. Being out in the middle of nowhere, for some reason, coming back was just much, much more difficult. They say that can be the case. And then I moved to Seattle and was taking post-bac pre-med classes, then moved back to New Orleans. My mother passed away, and then I was, doing all the finishing up my prereqs for med school and then in med school. So I had lots of stress going on. So I know that was a big trigger for me. And then, first year of med school, getting diagnosed with Graves. So what's kind of your experience with your patients or even personally in stress?
Yeah, well, stress without question was a factor when I was diagnosed with Graves. I mentioned earlier how I had adrenal testing through the saliva, and that showed both depressed cortisol levels, depressed DHEA levels. Funny thing is, though, I didn't think stress was a problem. I always consider myself to be good at handling the stress, even though I wasn't doing anything.
You seem fairly mellow. You seem like a pretty chill guy.
Yeah, I am pretty laid back, but I mean, the saliva test showed it all, but. I mean, looking back, the saliva test just gave me some answers and just made me look back. And, I wasn't doing meditation, or yoga, but I was working out. I was exercising regularly. So I thought that was enough to help manage the stress. And then, I just realized that it's not. And then, of course, over the years, learning more about mind-body medicine. And, so now I incorporate, deep breathing and heart math, which I know you're familiar with heart math. I use my inner balance every night, for stress management. And with my patients, it's very similar. I have everyone fill out the health questionnaire to rate their stress levels and stress handling. And, a good amount of people put the stress levels high, stress handling low. And of course, you can't always go by that. Even if someone puts their stress levels low, well, how was your stress levels? Maybe it's low now, but how was it a few years ago? Because again, it takes time for these conditions to develop. And oftentimes the answer will be, it was high, in the past, if it's not high now. And same thing goes with the stress handling. If they put high with stress handling, I'll use my experience, because if I had to fill out one of those questionnaires, and I probably did since I was working with someone, I probably did fill out the questionnaires, and I don't remember what I put, but I probably put like a 7 or 8 as far as stress handling, because I always thought I did a good job of managing the stress. So if someone does put a high number for stress handling, I'm going to ask them, what are you doing to manage the stress? In a laid back way, not really trying to put them on the spot. But a lot of people like myself, they think just exercising regularly or just, having the mindset that, okay, I'm doing good doing a good job of managing the stress is enough. But I find that most people do need to incorporate some type of mind-body medicine every day. And even if they don't, it's not going to hurt to do it. So I do recommend, even if it's only 5-10 minutes, because that's the big issue these days. It's time. Well, I don't have time to spend half an hour doing yoga or half an hour doing deep breathing, but most people could spare 5 minutes, to at least start with 5 minutes. And then, of course, you want to try to increase the duration of the stress management. But I agree. Stress is not only in my personal situation was a big factor, but with my patients, and I do adrenal testing with my patients to show them, that not only to look and see what their adrenals look like, but just looking at my experience, because again, I know some people, I think you don't do a whole lot of adrenal testing in your practice, correct?
I don't do as much. I mean, just again, it's kind of back to that leaky gut, scenario that I just kind of feel like if you're there with autoimmunity, the likelihood is that your adrenals are, stressed or compromised in some kind of way. And so trying to find out what that is and, managing it. Again, if somebody wants it, it's a great tool, and I check it on myself. Certainly it's a great tool to see, when that person says, oh, well, my job isn't getting in the way. And then you see that, their adrenals are bottomed out, or that they're on the high end, where they're still in the, in the overload and they haven't gotten to the burnout yet. It's a good tool to say, look, you're in the red. I mean, you are not managing this. So there are those people who really need to see that number. But, I try to be as conscientious as I can in and get the labs that I can't guess what's going on. I mean,
Yeah.
I can't guess what somebody's heavy metal level is. I can't guess if somebody has mycotoxins in their system, but I can assume that that your adrenals are at least, have some dysfunction, and that you have some amount of leaky gut, and is not going to hurt to support and repair those two things.
Yeah, no, I agree that most people have adrenal problems. I think what you said, the latter, you mentioned, and the same situation with me. It's like, and I didn't think I needed to see the adrenal testing, and that's one reason I do that, is just because even if I were to ask, well, the person, again, and yeah, there are some people who say, yeah, I know my adrenals are shot. But again, not everybody has the same pattern that I had. Some people will say, think that they're in a state of so-called adrenal fatigue, but they'll have the elevated cortisol levels and not depressed. And I do treat that a little bit differently. But I also do think what you said, a lot of people can benefit, or at least, some people could benefit, but I find a good amount of people could benefit from actually seeing it, and it serves as motivation. Well, wow, that my adrenals are so, but again, different perspective.
Well, that's the thing, right? Something works for you. I had a toxic mold experience, so,
exactly.
I definitely, it's on my radar. You maybe never have, a lot of people never have. So, I mean, prior to that, it wasn't really on my radar. I mean, Lyme, and thankfully I haven't had Lyme, but, I just didn't want it to be on my radar because I didn't want to have to start dealing with Lyme. Now that it's on my radar and I have a good test that can go through the insurance to test for it, I'm picking up all kinds of Lyme. I pick up all kinds of, so it's just, you had great success with that. And so, that's what's going to work for you. And, people are going to come to you because they're going to feel that, like, oh, that's my issue. And I really resonate with him because, with Dr. Osansky, because, I know that the adrenals are my issue, and he tests or whatever, and somebody else is going to listen to me and think, I think I have Lyme or toxic mold in my house. That's who I want to go to. And so that's also what I think makes the world go round, and why you maybe have patients that you're finding that in, and I have patients that I find, what I'm looking for in, because they're also reading your book and reading my book and listening to these and feeling like they're drawn to you, or they're drawn to me, or they're drawn to someone else. And that's why, the world is great, because we just, attract what we're looking for, and they're getting attracted to what they need.
Yeah, you're right. And I will say, I don't do a whole lot of testing for mycotoxins, but I did learn about real-time labs from you. So that, listen to a past podcast. That's who you use, or that's right. So again, so that's something. You're right. So if, I consider you the mold expert.
Yeah, so just kind of, wrapping that thought up, that, people are obviously attracted to the practitioner that, they sense is gonna help them. And I think that, we attract the patients that we can, that we can certainly help. So I think before we wrap up, definitely want to talk about some of the herbs. So that's something that I, definitely have incorporated in my practice after reading your book. Some of the herbs that you used and that are recommended while someone's working with a practitioner, or reading your book, or reading my book, and working through finding their root cause. Just, what can they do to get some symptom relief without having to do what I did, which is take really harsh medication. So you want to walk us through some of the herbs that you typically use in your practice?
Sure. Well, probably the most common herb I use for Graves' disease is bugleweed, which is an anti-thyroid herb. And so bugleweed, just obviously not as potent as methimazole or PTU, but it helps to lower the thyroid hormone levels. Whereas motherwort is an herb that, think of it as a natural beta blocker. Again, not as powerful as a beta blocker such as propranolol or atenolol, but again, that focuses more on the cardiac symptoms. So when I was dealing with Graves' disease, I started out taking bugleweed, and I did notice an improvement with my symptoms. My pulse rate definitely were decreasing. My palpitations were decreasing, but I still had some palpitations, and I added motherwort, and the motherwort helped greatly with the palpitations. So I was taking both bugleweed and motherwort. And there's lemon balm. Now, I didn't take lemon balm, but some of my patients take that. Lemon balm does have some mild anti-thyroid activity, and it has a calming or sedative effect. So if someone with hyperthyroidism especially is having problems sleeping, then you might want to take some lemon balm at night. L-carnitine in the research shows that higher doses can potentially lower thyroid hormone levels and help with hyperthyroidism. Those are the main ones I use. There's also lithium, which I don't use really in practice. Everybody is able to successfully manage the symptoms through the herbs. So I fortunately was able to do that, and many of my patients are able to take the herbs. But there are some people who need to take the methimazole or the PTU. Most medical doctors seem to recommend the methimazole first, although some will recommend the PTU. But either way, you want to be safe. So if someone comes and sees me, and if they're already taking, let's say they're on methimazole and they're doing fine, and they're happy with the methimazole, I'm not going to tell them to stop taking the methimazole. I'm going to because even the bugleweed or the motherwort, that's not addressing the cause of the problem. It's just managing the symptoms naturally while we're addressing the cause. So if someone's taking a medication, they're happy with it, doing well, that's fine. If someone either like you who had a negative reaction to the medication, or I'll have people who just aren't taking anything. They're not taking any medication, not taking herbs. So in that case, usually if they're not taking anything, it's because they don't want to take something, and I will try to get them on something as quick as I can, because we don't want to play games with their symptoms. If someone has a high pulse rate, we want to make sure to get that under control. So I usually will start them. It of course depends on we'll do a thyroid panel if they haven't had one done recently, and see what the numbers are and see what their symptoms are. Because there are some people with Graves, they might have elevated thyroid hormone levels, but they don't have an elevated heart rate, which again, that's not common, but still if someone falls within that category, then I'll have them take the bugleweed to help with the elevated thyroid hormone levels. But if their resting heart rate is 70 or 65, then I'm not going to have them take the motherwort.
Yeah.
So it really does depend on the situation.
Yeah, I mean, that's good. We actually in my store carry kind of a all three in one formula. And, I guess there can be downsides to that, but, it's also helpful. Then you're not dealing with, 3 different herbs and, trying to sort all that out.
And it won't hurt. Like if you do, I have some patients already seeing me and they're taking the combo product. And if that's the case, taking motherwort, it's not like a beta blocker where if you take it and you don't need it, it's going to lower your heart rate significantly or your blood pressure significantly. So even if someone technically doesn't need it, but they're taking a combo formula already, and if they're doing well, then usually that's not problematic.
Right. And so, somebody can be taking these herbs while they're taking one of the, prescription formulas and just monitoring their symptoms, right, with their doctor and monitoring their labs.
Correct. Yeah. So people can take both of them. Like they could take the bugleweed and the methimazole, or, methimazole and the motherwort. Or the formulation, for example, like you're mentioning, and still take the medication. But yes, you definitely want to monitor your symptoms and then do a regular thyroid panel, thyroid panel on a regular basis.
Right. And then what about, we've been spending a lot of time for those people who have not, necessarily had an invasive intervention like surgery or radioactive iodine. But certainly there are people out there like myself who've already had something invasive. And I mean, obviously, I'm sure you believe, as do I, that still they can go through this, approach to addressing the underlying cause, and they should if they never have, or else they're leaving themselves open to potentially something else. Is there anything else that you'd recommend to them to kind of restore their health?
Well, I mean, that's the main thing, is that it's an immune system condition. So if someone received radioactive iodine, or if they, had a complete thyroidectomy, especially if they had a complete thyroidectomy, then you're obviously you're going to have to be on thyroid hormone. But radioactive iodine, it depends on the dosage. Some people will actually need more than one dose of radioactive iodine to fully ablate the thyroid gland. So if they only went through one dosage, and again, it depends on how high of a dose they use. But the focus is going to be on the immune system. I mean, the Graves' disease, as you know, as we're talking about, it's an immune system condition. So when someone comes in, or, someone contacts us and they say, well, I've already received radioactive iodine. Is there any reason for me to take a functional medicine approach? And, the answer, of course, is absolutely, because the radioactive iodine didn't do anything to address the autoimmune component. And so you're more susceptible to developing other autoimmune conditions in the future. And, and of course, it doesn't do anything for compromised adrenals, the leaky gut, which relates to the autoimmune component. And, so yeah, there's definitely hope for people who have received radioactive iodine. And again, it might not mean that they still might need to take the medication, the thyroid hormone medication, on a permanent basis. But even when this is the case, you still want to, of course, improve the health of the immune system and try to reverse the autoimmune component.
Yeah, absolutely. Well, I couldn't agree more. Well, before we part ways, I've been asking everybody, if they'd be willing to kind of share, 3 takeaways of how to, in your case, I guess, support or reverse Graves' disease. Anything that you want to leave our listeners with?
Yeah, well, number one, I do want to reinforce that you want to be safe, just because I do see a number of people who, they don't want to take the medication, which is okay. But if you don't want to take it, try to find a natural healthcare professional who has some experience with Graves, and get on the herbs, get on the bugleweed, get on the motherwort, and do something. So symptom management is number one with this condition, because again, you don't want the heart rate to get too high. There is a risk of thyroid storm, heart arrhythmias, not to be, not to scare anybody,
Yeah,
but again,
absolutely.
So you want to be safe is number one. Once you have the symptoms under control, then diet is the next area that I would start. So as I mentioned earlier, I would have, I pretty much have most of my patients with Graves follow a strict autoimmune paleo diet for at least 1 month. So I would recommend that, and then see how the first month goes. And, if all goes well, and, then definitely continue with that. And then if you're struggling, we can consider reintroducing foods. And again, best to work with someone on that, but that is something they could do on their own, that you don't really need to work with someone to follow an autoimmune paleo diet for 30 days and see, how you do. And then stress, definitely the stress management is huge, just because we tend to overlook that. When doing things naturally, we're inclined to take supplements, and we know we have to make dietary changes, but we neglect the stress. So as I also mentioned earlier, if you're not blocking out time for stress, you want even if it's 5 minutes per day, preferably more, but even if you need to start with 5 minutes a day, and the key is to do it every day. So this isn't, it's not like going to the gym 3 times a week. This is something you want to do, Monday through Sunday, get into a routine. It might be tough at first, but once you get into the routine, it'll be easier. And then hopefully, again, you can increase the duration. But stress, it wasn't just my experience and my patient's experience, but I didn't mention earlier that there is actually research that shows
Absolutely.
a correlation between Graves specifically and stress.
Yeah, and autoimmunity in general, I frequently will have patients tell me that, they had a flare of their rheumatoid arthritis or their MS or their whatever, because after a stressful situation, Crohn's, ulcerative colitis. There's not really any sort of autoimmune disease. Maybe people can't tell with Graves or Hashimoto's if their antibodies have gone up, but many of the other ones definitely have symptoms and frequently noted during stressful times. Psoriasis gets worse, things like that. I hear that all the time. So, yeah. Well, Dr. Osansky, this has been really great. I read your book and I was looking forward to speaking with you, and it just was so refreshing. We're really on the same page with, kind of how we, not only that we both had Graves, but, just in our approach to a patient with Graves' disease as well. Can you tell our listeners how they can find you if they want more information?
Sure. Well, they could visit my website, naturalendocrinesolutions.com. So that's probably the best place to visit. And I do offer a free guide on Graves' disease and Hashimoto's. And then, of course, for those with Graves' disease specifically, there's my book, Natural Treatment Solutions for Hyperthyroidism and Graves' disease, which you can find on Amazon.